Hi, I am Dr. R. Satyaraja, Assistant Professor, Faculty of Physiotherapy, Dr.M.G.R. Educational Research Institute, Chennai. The test now is upper limb tension test. It is one of the major tests which is equivalent to the SLR, straight leg test of the lower limb. It is also called as brachial plexus tension test or Ellis test. It was first described by Ellis, that's the name it includes as Ellis test. There are about 4 different tests which are said to be as upper limb tension test 1, upper limb tension test 2, upper limb tension test 3 and upper limb tension test 4. Upper limb tension test, as we said earlier, is a neurodynamic test. It creates dynamic stress in the neural tissue, typically the cervical spine. Initially while we do the test, what happens is we start with the larger joints first and then go with the smaller joints. And while doing the test, we do for the normal side, that is the unaffected side, and then we do the test for the affected side. So let's go for the test, and when you go for the upper limb tension test, the test is done in the manner where the shoulder is being abducted to 110 degrees. So there is a depression of shoulder, come closer, yeah. There is a depression of shoulder is made to abduct at 110 degrees and wrist is at supination and with arm supports. So what you do is you do a depression and you support your arm and you go for an extension of the elbow. Hold it for a few times, look at the patient's mind for any signs and symptoms, so the reaction, and come back to the position. So this is upper limb tension test 1, which is typically done for your median nerve, anterior interosseous nerve, or for the nerve roots of C5, C6 and C7. Now we go for the upper limb tension test 2. It is done in the patient position, bringing him to the end of the couch, creating a depression, mild shoulder depression, okay, and with wrist under, forearm under supination, and then we go for wrist under extension, fingers and thumb under extension, and in this matter we create an extension of the elbow. Hold it for a few seconds and you can see the signs and symptoms, and slowly bring it back to the position. Upper limb tension test 2 is typically done for the median nerve, your musculocutaneous nerve and your axillary nerve. Upper limb tension test 3. Let's go for the test. So this is done the similar manner with a shoulder depression, a mild medial rotation, an arm abducted to 10 degrees. Here the forearm is created a pronation with wrist and finger flexion and support. So with the depression and an abduction, we create a movement. Wrist elbow extension with wrist and your fingers flexion. So with this position, what we can see is an mild positive signs. Upper limb tension test 4. So this is performed, the patient bringing the edge of the couch and bringing the arm, shoulder under depression, bringing the arm to abduction at 90 or to 110 degrees with first initially at the extension with the elbow, and you create an extension of the wrist, an extension of the fingers with a supination and a radial deviation of the forearm, and slowly you start to flex. So from the position you start to flex. This creates a tension over the little finger and over the forearm, typically over the ulnar nerve area. Upper limb tension test 4 is typically done to test the ulnar nerve. So the positive signs in upper limb tension test which may include are typically at the end range, only at the end of the range when we do the movements we can find the positive signs. The signs may be typically a tingling sensation or a resistance to move, or it may have a dull aching over the area of its distribution. So when we do the test might range from minimal to no signs. It is typically normal, and sometimes we can sensitize by the movement of the cervical spine, typically towards the flexion of the opposite side, as a lateral flexion towards one side, or by neck rotations. So in this test as a whole, the upper limb tension test, a neurodynamic test, will conclusively tell about the distributed area, the nerve root involvement and the neural tension.